Fireman Muhammad Adib Mohd Kassim came out of unconsciousness on the 6th day of his hospitalisation at the National Heart Institute IJN, but told a specialist that he did not know what happened to him. IJN's senior consultant cardiothoracic surgeon, Datuk Dr. Mohamed Ezani Taib, told that to the inquest into the fireman's death on Monday. He was among the specialists treating Mohamed Adib and is the 14th witness called to the inquest. Dr. Mohamed Ezani said on the 5th or 6th day after Mohamed Adib was transferred to IJN, he asked the patient whether he remembered what happened to him, and the fireman shook his head. The doctor said Mohamed Adib gave the same answer when questioned by the investigating officer on his case. When asked whether he knew of anyone else who have asked Mohamed Adib on what happened to him, Dr. Mohamed Ezani said a staff of IJN named Asyraf told him that he also asked the fireman the question. Dr. Mohamed Ezani said Asyraf told him that the firefighter nodded his head when he asked the patient whether he remembered what happened to him. The doctor said he then told Asyraf to relay the information to IJN's legal team. Another witness, the hospital's intensive care unit ICU director Datuk Dr. Suneta Sulaiman said Mohamed Adib was alert and able to communicate several days into his hospitalisation in IJN using hand signals, as he was still unable to talk since he had a breathing tube in his throat. Dr. Suneta said Mohamed Adib was also able to complain of pain on his right shoulder by pointing with his left hand. She added that the patient's consciousness, however, was fluctuating as he was on sedation medication throughout his time in ICU. Mohamed Adib was critically injured when he and his team members from the Subang Jaya Fire Station responded to an emergency at the Seafield Sri Mariamman Temple where riots were happening last November.